Nasser Hospital, as well as many other hospitals in the Gaza Strip, is full of wounded people coming one after another due to the shelling by the occupying regime. From this hospital, the biggest in Khan Yunis and also one of the biggest in the Gaza Strip, our correspondent in Gaza gives us the following information.
Nos encontramos en el hospital Nasser.
We are in the Nasser Hospital, the largest hospital in the Khan Yunis and also one of the largest in the Gaza Strip. This hospital, like many other hospitals in the Gaza Strip, is full of people. As we can see, it is full of wounded people who are coming one after another due to the occupation regime's bombardment. Unfortunately, this hospital, like the other hospitals in the Gaza Strip, is suffering from a great shortage in terms of medical supplies, medicine, and above all, fuel. Probably in the next few hours, this hospital may stop operating like 10 other hospitals in the Gaza Strip that have stopped operating due to the lack of fuel and medical supplies. We now proceed to talk to the director of the Nasser Hospital in Khan Yunis to explain to us how the situation is being handled in times of war.
The Nasser Medical Complex receives numerous cases. There are many injured that exceed its capacity. The vast majority of these cases require admissions, operating rooms, and intensive care. Many times, we have multiplied our clinical capacity for more admissions. However, the numbers of wounded and injured are very large. We need more clinical beds and intensive care beds for them. But the majority requires emergency surgery that do not exist in intensive care and do not exist in the Gaza Strip and need to be transferred abroad to complete their medical care and save their life. This facility is at the doorstep of a major catastrophe, an environmental catastrophe resulting from the congestion and overcrowding within the partitions, corridors, and open spaces in this facility, dealing with many displaced civilians seeking a safe place within this facility. Because all of this, we call on everyone to get safe places for the citizens, to be able to move them to those places and to be able to provide a safe medical service. We are currently providing an unsafe medical service. There are contaminated wounds, we have a proliferation of epidemics within the complex and among the citizens and within the medical staff. There are respiratory infections, skin ulcers, rashes, chickenpox, many epidemics resulting from overcrowding and disinfection and cleanliness.
Well, as the director of this hospital has just informed us, they are telling us that there are a large number of wounded, a large number of martyrs who have been deliberately coming to this hospital. He's even telling us that there is not enough space left in the intensive care and in the operating rooms. They are also telling us that the electrical supplies that remain to run the operating rooms are almost running out. Even yesterday, a doctor performed a surgical operation with only the flashlights of the mobiles. He also warned us that because hundreds of people are using this medical center as a shelter, the number of diseases is also increasing. New pandemics are growing. People are starting to get sick. We have been assured that if the situation continues, the medical center could collapse. They have also asked us to put pressure on the international community in order to put pressure on Israel to allow the entry of fuel, the entry of medical material, and to be able to at least attend the wounded who are in a very serious health situation.